So we are going to talk about potassium, and it is the normal range is going to be 3.5 to 5.0 milliequivalent per liter. It is an intracellular cation, and it's a cation because it's positively charged. It's very important, so that's what the star means, that it's important in nerve conduction and muscle contraction. It's primarily excreted in the urine, influenced by aldosterone. And aldosterone is a enzyme. Produced in the adrenal cortex in your kidneys, and what it does is it holds on to the sodium and water, and it pushes out potassium to make room for sodium and water. So and it is also influenced by your acid-base balance. So like if a patient has acidosis, that's where the potassium is going to move into the cell. So that will mean they are hyperkalemic. Or if they're alkalosis, potassium is going to move outside of the cell, so that causes that cell to swell, and that is hypokalemic. So then we get on to the causes of hypokalemia. So a way to remember is it's called ditch the K. Your body is going to ditch the K because you don't have that potassium in the cell. So you're ditching your potassium. So if you think of D, you can think of diuretics. I is going to be inadequate K, like potassium intake, which can then cause the anorexia, nausea, having too much water because your cells are going to then start to swell. So like a disease called Cushing's syndrome, where it has that increase of aldosterone. So remember when I said aldosterone is where it pushes that potassium outside of the body. You're getting rid of all the potassium. And then H for heavy fluid loss, so like vomiting, diarrhea, sweating. So then that can show the signs of hypokalemia. Everything with hypokalemia is going to be like slow and low. Like they're going to be very slow moving. They're going to be just low like reactions. So you'll see what I'm talking about. So like dysarrhythmias and cardiac arrest. So that can mean like they have bradycardia, so their heart beats slower, or they can have just abnormal EKGs to where then it could lead them to then cardiac arrest. And then a weak pulse, so that's where the slow and low comes in. Their pulse is going to be very slow. They're going to have that nausea and anorexia due to the low potassium intake. The respiratory muscles are going to then become weakened, so then that will be shallow respirations, again slow and low. And then they'll have polyuria, which is an abnormally large amount of urine loss. So then that's when we go back to the heavy fluid loss. They're having too much. And then you can also say, because of the polyuria, they could possibly have the increase in aldosterone, which is then going to excrete all the potassium out of the cell. And come back for hyperkalemia. Okay, sorry for the glare, but now we're going to move on to hyperkalemia, so a higher potassium level, so that is going to be, I forgot to say this in the other one, but hypokalemia is going to be less than 3.5 milliequivalent per liter, and then hyperkalemia is going to be more than the 5.0 milliequivalent per liter. So signs of hyperkalemia, so you could think the body cared too much for potassium. So with hypo, the body was ditching the potassium. Here we're caring too much for it. We have too much of it. So that's going to be your cellular movement of potassium in to out of the cell. So you could think of burns, adrenal insufficiency, renal failure, and then we have the excessive potassium intake. So like when we had the hypo, we had not enough. So here we have too much. And then you could think of drugs, so like the NSAIDs. And then we move on to the signs of hyperkalemia, and a way to remember is called murder. I've always known working in the hospital, if a patient has way too much potassium, it can become very dangerous and they can die. A little morbid, but that's a way to remember. So it kind of clicks. If you have too much potassium, think of signs, think of murder. It's not good. So they're going to have the muscle weakness. They can have urine absent or little, so you could say oliguria, I think I'm pronouncing that correct. Respiratory failure, and with that you could have seizures as well. a decrease in the heart contractility. So that means they drop in the blood pressure and a drop in the heart rate. So if they're having a decrease in their contractility, it won't be working as hard to get our blood pressure normal or our heart rate moving in the right direction. And then also early signs of muscle twitching. So you could have like the paresthesia. That's where like you're having the tingly sensations and stuff in your fingers. And then rhythm changes. So they will have like on an EKG, they will have the tall T waves. With your T waves, they are normally like a little round. With this, they will be excessively tall, and then your QRS will be also wide as well. They could have like dysarrhythmias, cardiac arrest, so anything with the rhythm changes is not very good. So I think we totally covered potassium. Thank you, and come back for more.